Hello and welcome to Exclusive Interview, coming to you from the studios of 84 TV Radio Abuja, Nigeria. My name is Stanley Bentu. Over the years, the world has faced many viral epidemics. And no, I am not talking about the internet. I mean viruses that have caused illnesses like Lassa fever, Ebola, and the recent one to take center stage, COVID-19. Viruses have become the new global threat, as recently expressed by billionaire philanthropist Bill Gates. But there is one virus that has been with us for quite some time now and forced us to a stalemate. Have a look.
Acquired immunodeficiency syndrome is a condition in which progressive failure of the immune system allows life-threatening opportunistic infections and cancers to thrive. The disease was first clinically observed in 1981 in the United States and was found to be caused by the human immunodeficiency virus. Science has come a long way since the dreaded early days, and HIV is no longer considered a death sentence, but rather a chronic condition that can be managed with treatment. Research has shown that HIV is untransmissible through condomless sexual intercourse if the HIV-positive partner has a consistently undetectable viral load. As the world begins the fifth decade in the AIDS epidemic, one of the greatest challenges is combating complacency in HIV prevention. To date, tremendous progress has been made in both prevention and treatment, but we must be cautioned that despite a tendency to declare victory, the epidemic is far from over, and the world may face unexpected challenges as a result of recent advances in treatment. While the tendency to relax in the assurance that we have made remarkable progress in a very short time, the danger of complacency is perhaps greater than ever before. We may become a victim of our own success if we do not acknowledge the need to increase prevention efforts in emerging populations at risk and to face a number of dangers that have emerged. If we relax prevention efforts either on a national or on an individual level, progress to date could be reversed. The Institute of Human Virology Nigeria is a non-governmental organization that focuses on HIV and AIDS-related problems in Nigeria. It was established as an affiliate to the Institute of Human Virology, University of Maryland School of Medicine, Baltimore in 2004. In 2016, IHVN claimed that it reaches 2.3 million Nigerians with HIV testing services, including about 25,000 who tested positive for the disease. On today's edition of the Exclusive Interview, we speak to Dr. Patrick Dakum, the CEO of the Institute, about the current infection rate of the virus in Nigeria and strategies to stop its spread.
I've just been joined by the Chief Executive Officer of the Institute for Human Virology right here in Nigeria, and his name is Dr. Patrick Dakum. Doctor, it's a pleasure to have you here.
It's great seeing you again, Stanley, and quite a bit of time. But nice to see you again.
Very nice to see you, sir. Now, you've done so much work at the Institute, especially concerning HIV/AIDS. Can you tell us what the prevalence rate is in Nigeria as of today?
Well, the prevalence rate in Nigeria as of today is about 1.4%, and it's a very huge drop in terms of where we were about 5 years back. And about 7 years back, we were at 3.4, thereabouts. And to me, I believe that this new rate is just goes to show the effort that has been put in by all stakeholders, funding agencies, Nigerian government, and key players, including the community of people living with HIV. So we did in 2018, the federal government, along with a number of partners, carried out what is called the Nigerian AIDS Indicator and Impact Surveillance, and that surveillance gave us a new prevalence rate. Now, having said the prevalence rate is 1.4 does not mean that we're out of the woods, because you still have pockets of communities where the prevalence is pretty high. And there are communities or states that, even though the prevalence is just a little bit above the national average, they still do have a burden of disease that is high. And what we mean by that is that here is the population of a community or a state, here is the prevalence rate, but we do know how many people are currently on treatment. So if you take the number of currently people on treatment and the projected, those expected to have the virus based on the prevalence, you get what the burden of disease is. And currently the burden of disease is higher in some places in the country.
Like around what areas or what places, which states?
Two states have come out very prominent in terms of highest burden of disease, with over 150,000 individuals that we project to be living with the virus that are not yet on treatment. And those two states are Rivers State and Akwa Ibom State. Those two states, we within the U.S. government funding agencies and with the government of Nigeria refer to those states as surge red states, because in those states we are looking forward to doing a lot more extra work. So, for example, the Institute of Human Virology Nigeria is focused in Rivers. And the goal we have there is within 18 months, and the 18 months is coming to an end in September, to ensure that we have put close to about 150,000 people on treatment. That's not easy. And a lot of strategies that we have had to deploy in order to get there. Akwa Ibom State Family Health International is responsible for providing the technical support. They are working alongside all stakeholders. So we also do work within HIV in a number of other states. The FCT and the Nasarawa state, we work with CDC funding from those states, including Katsina. We also, as an institute, are working with Chemonics, who are the key recipients of a grant from USAID, and we are the technical partners, and we currently are in the northwestern states. We're hoping that probably we'll be able to move on to the northeastern states too.
Now, there's been a lot of advancement as far as treatment of HIV. How far away are we from a cure?
We are as far away as God will reveal to us what the ultimate is as far as getting a cure is concerned. Now, having said that,
is not encouraging enough.
Having said that, usually when we ask about cure, the first thing I say is that let us note that HIV is not the only disease that has been managed that does not yet have a cure. We do have hypertension, people take drugs for life. We do have diabetes, people take drugs for life. Now we have HIV, people take drugs for life. There is treatment, and like you have said, there are treatments that are
none
effective.
of those are infectious, though.
None of those are infectious. However, if you talk about infectivity, you are talking about the ability of person who has it to transmit to another person. And we have also looked at the science behind infectivity, and we can safely say that once your viral load, the number of viruses circulating in your blood, is undetectable to a large extent, you are by and large safe from transmitting it to another person.
So, and this is it. I think that there needs to be more education about the concept of being undetectable and the possibility of someone whose viral load is undetectable to infect another person. So can you shed more light on this?
If you had taken note of all that was happening during the World AIDS Day, we had a campaign slogan called "You is equal to you." You is equal to you. You, the letter U, is equal to the letter U. Undetectable is equal to untransmittable. And we had T-shirts, we had a lot of activities surrounding that. But like you have said, it's one thing to have a one-day World AIDS Day campaign. It's another for continuous community education, which is actually what we need to do. Currently, there is quite a lot of education going on in the community of patients that live with HIV/AIDS. But I think it's also important, especially for the sake of reducing stigma.
Stigma is a very big problem with HIV/AIDS. It's one of the main reasons why a lot of people either refuse to get tested or prefer to keep their identities
unknown,
basically.
Right. You're absolutely right, and I think that's an area that we are working, and we need to continue to do a lot more work. Now, back to the question you have asked on cure. It is not as if there isn't a lot of work ongoing. There's a lot of work ongoing in terms of looking for a cure. People are looking at a number of options. There is what we refer to as functional cure. What we mean by functional cure is that could we now have an agent that after you take it, you do not need to take the drug again, even if the virus is still somewhere in some cells. As long as
suppress the virus.
Permanently suppressed, and you do not need to take drugs. We will refer to that as functional cure. We are looking at science is looking at all of that. The other is that there are a group of people that we call long-term non-progressors. These are people that have the virus. You can detect it in their blood, but they have not come down with the disease, and it's 20 years, 25 years, 27 years, and they don't have HIV. They don't have the disease. Yeah, it has not developed into AIDS. So the question is, what is it that they do have that is making them not progress to have AIDS? So science is moving in that direction. There are a number of candidates that are what we call vaccine candidates, and those candidates also, there's one that has been tried by the US military in Thailand, and that's the one that from all reports has shown some level of coverage, but not enough for us to say that we now do have a candidate vaccine that we can, mass produce for production. So a lot is going on, but like I did say, the challenge with HIV is in the fact that you have the cells staying, there are viruses that enter inside the cell, make your cell to replicate itself. And because of that, attacking it and clearing it completely has a risk of also clearing your own normal cells, and therefore makes it very difficult to attack.
I read that the biggest challenge is with the unknown areas where the virus may have reserves or may have built or planted reserves. So it's still a challenge finding out where these reserves are. And
the reserves by and large are known. However, getting to them with any agent that will get to them in a way that those cells are not destroyed is the issue.
That's the major challenge.
That's the major challenge.
Okay.
And I believe that by and large, as we move on, little breakthroughs here, especially from molecular biologists, people looking at the cell replication, looking at what is it that makes the cell to multiply, what stops it from multiplication, what can we put that will ensure that nobody can get it, and if you get it, how are we going to get agents that will get into every cell and then replace themselves with replace the HIV virus with themselves, so that the HIV virus has no home. We are hoping that if we move in that direction, it will be solved.
Okay, well, is there a time frame? I remember reading one time that we were looking at 2030. Does that still hold through, or has the goalpost been moved?
It's extremely difficult to predict. It's extremely difficult to predict. But for me, I think knowing what science is ongoing, I do not expect anything in the next 10, 15 years.
Okay, well, I just want to, we have to take a break very soon, but I want to talk about stigma and the stigma attached to this. Have you witnessed in the course of your work a changing attitude among Nigerians especially?
Well, there is quite a lot of advancement, I would say, in the attitude of people towards those who are living with HIV. Basically because people suddenly discovered that family members do have it. They discovered that friends do have it. And therefore, it is beginning to break down the barrier. We will not say that stigma is gone. Stigma is not gone. Stigma is still there. But it is now in such a way that it's not as what it used to be. Remember that in those days, you go to a mosque or a church service, and they look at anybody with HIV as the worst sinner. Now, compassion has replaced that. Now, care has replaced that. Now, if you go to a clinic in those days, you will not need to be told where the HIV clinic was. Because by mere looking at the patients that are gathered there, you will know. That's why it was called Slim's disease. But now you go around the hospital, you will not know. So because people that are on therapy look well now, it has gone a long way. Unless somebody reveals it to you, you are not going to know.
You would have no idea.
Yeah.
Okay, well, we'll take a break now, but when we come back, we'll also look at attitudes of Nigerians towards prevention and self-protection. Don't go away. We'll be right back.
National Orientation Agency has to do more to let people understand that when you stigmatize, it doesn't help. It kills the person more than even the virus. So I think it's something we have to join hands and support whoever is infected.
It's better you get to know your HIV status early, because early detection helps. Because if you think, I don't want to go for HIV test, I don't want to know my test status, just because of that fear of being HIV positive. What happens when it stays in your body 5-6 years without you knowing of it? By the time you get to know about it, it must have eaten up your immune system.
The stigmatization, I don't think it has gone down, because antiretroviral drugs has helped people without HIV, has helped us not to know those who have HIV. Because if you're on antiretroviral drugs, people do not get to know that you have HIV, because they begin to look healthy and it, subsides the virus to a minimal. But the stigmatization is not over, because if I hear that you have HIV, I don't want to have any dealings with you.
Do you have a ceremony or an occasion you want covered? If yes, contact us to give you unparalleled services on our TV, radio, via YouTube, Facebook, Instagram, Twitter, and LinkedIn. We also have an outdoor garden facility to cater for all your ceremonies, such as birthdays, reunions, receptions, etc. Our rates are modest and customer friendly. Please visit us at number 3, plot 833, Emmanuel Aguna Crescent, Jabi, Abuja, FCT, Nigeria. For more details, contact us on the following numbers: +234 80 80 87 4444, +234 90 555 62 444, +234 702 033 3444. AD4 TV Radio, reliable and credible. Learn on the go.
Welcome back. Well, we've been talking to Dr. Patrick Dakum, who's the Chief Executive Officer of the Institute of Human Virology Nigeria. It's based here in Abuja. And one of the things that I was very interested about, that I mentioned before the break, is to what extent Nigerians are actually keeping themselves safe or protecting themselves from exposure to the HIV virus. And there was a research that was done by NOI polls recently, and it was quite startling, because it showed that 66% of Nigerians still do not use a condom when having sex, even with strangers or people that they may be having sex with for the first time. So how do we tally this with the infection rate of 1%? Wouldn't that suggest that there's a possibility that the rate could be higher?
Well, first of all, it's unfortunate that people are still having risky behaviors in unprotected sex once you're having sex with an unknown partner. Unknown in the sense that you do not know the status of that partner. For all intents and purposes, I believe that one of the major reasons that has led to the drop is the fact that treatment is also prevention. The more people that you have placed on treatment, the less the number of people that can transmit the virus. Because like we mentioned earlier on, there are quite a number, once you are undetectable, then transmission is next to zero. So it means then that the more people that we have placed on treatment, we have crashed down the potential number that can transmit. Now, why are we still having why are we still having a gap in those on treatment and those that potentially do have the virus? Is because of the 60% we're talking about. The number of people that are still, taken risky behaviors. For example, you go to a number of communities. First of all, you probably ask, where can I get a condom? The question is, very, very rarely do you find free condoms anymore. At the initial campaign, they were, but now it is not easy to find condoms distributed freely like it used to be. Secondly, we also, those of us that work in the, HIV community, need to do a lot more about reinvigorating prevention messages.
Because
over time,
do you feel
have
a sense that there's complacency.
Exactly. Over time, you will discover that when the epidemic was at its peak, people were everywhere. You open a radio, you hear, the show for Facebook, but now you don't hear those things. And there is a new generation of people that do not know what it used to be. All they have gone to come, there is this disease, well, take good care. Well, I don't think she will have it, or I don't think he will have it. And they just assume. Because in the past, people who do have it look sick, but now they don't.
Now they don't.
So I think the pulse is real. The basic reason for me, one is education has gone down in terms of awareness for people, and two, availability of prevention methods, condoms, lubricants, availability of any other thing that people, messaging that will enable people live a healthy life.
And what about in the rural areas? Because a lot of what we know coming from the urban areas, but this message has to go much further than that.
That's why I'm saying that we have not done a very good job of continuing with the penetration of information right to the rural areas. There are, if you go to a number of communities, they know that there is a disease like that, but what do I do about it? It's difficult. And even for those who know in the urban areas, the proper use of condom is not there. That education, all they know it's a condom you wear, but there are proper ways that you use even a condom for it to be effective. So
you need to use it constantly and correctly.
Absolutely. So it's a knowledge, it's an attitude, it's a practice. Knowledge in the sense that the knowledge still needs to be reinforced in communities, both urban and rural. But secondly, people have attitudes to stuff. That's why we say attitude is the bridge between knowledge and practice. If you do not have the right attitude towards it, I don't believe them, my pastor said this, my village head said this thing doesn't exist in this, our village doesn't have this. No matter what your knowledge is, if that's your belief and attitude, it's difficult for the practice to be what it is.
Now, in this same research, something was discovered, and that's that out of the 66% that simply does not use the condom, 33% due to religious reasons. So, do we have harmful religious practices or beliefs that actually keeps this problem going on?
When we talk about religious beliefs, I think it is the concept of healing that people are referring to.
And we were just having a chat in between takes where you said to me, when somebody says, God told me.
Right.
How do you argue?
How do you argue with a person like that? So I tell you what we did in the early days, which is something that we need to continue to repeat. And so in the early days, what we did was that we found out there is a local local denomination that was going to have a conference of their pastors. And the sermon then is that, cursed are you for coming down with this virus. Your sins have found you out. That's what it used to be. And so we got Kyomuhangi, is a reverend gentleman, to come talk to them at the conference. There were close to 2,000 pastors, and he preached. He was a motivational speaker. He spoke very passionately about trying to show compassion to people who are sick. Asked the rhetoric question, what would Jesus have done if he were here walking the streets and found somebody with HIV? He would care for him. So what are we supposed to do? And at the end, everybody was happy. They hugged him. They, shook his hands. Then he went back to the pulpit and said, just a little announcement. I am HIV positive. And once he said that, the entire place became quiet. He said that you have hugged me. You love me because of what I've said. So the fact that now I have the virus, what has changed?
What has changed?
Nothing. So it broke down the stigma from the pulpit at that time. We have done that also with a number of imams. And therefore, you'll find out there is an organization now, Nigerian religious leaders living with HIV/AIDS, you know. So you have priests, you have pastors, you have imams who have the virus and who preach and who are advocates for breaking down the barrier. And the barrier to be broken is not only in terms of taking care of people that are positive, ensuring that you stay negative if you are, but also the barrier of faith healing, where people now go to their clergy and then they tell them that, oh, you have been healed. If you go back to those people, it means it's a lack of faith.
If you continue taking medication.
If you continue taking medication, it means
it's a sign of lack of faith.
It's a sign of lack of faith. So what we tell them is the fact that, well, for the healings, and if you read the Quran, read the Bible, Jesus Christ is seen as a healer in both books, you know. And if you look at the healings, it says, go show yourself to the priest. And so we say the priest in our context is the lab scientist. So I don't doubt that God can cure and remove the virus. I have absolutely no doubt about that. But it is his prerogative to do it, not your prerogative. And what you need to do is, if you claim or believe he has done it, go to the priest or go to the lab scientist, and he proves that it is now negative, invite me to the Thanksgiving. I'm going to be there. So it means then that there is a lot of work to be done with religious bodies in how they present the message of faith to people who are infected with this virus. Because if they present it in the wrong way, people go, they don't take the drugs again, the viral rebound happens, and therefore they are now circulating the virus all over. Now, the other thing to mention related to the prevalence and the current efforts as, you know, getting the virus under control is what we call key population. Currently in the survey that was done, while general population prevalence is low, the prevalence amongst key population is high. Who are the key population? Mainly one, female sex workers, two, men who have sex with men. And a number of the men who have sex with men are also sex workers. And in that community, the prevalence is still very high. In fact, in some pockets of that community, the prevalence is as high as 30%, meaning that one in three of them is positive. Now, the danger again in what we see in the key population is, or the population of MSM, that's men who have sex with men, is the fact that a number of them are bisexual. Bisexual in the context that they now have wives, female wives, and these female wives, they marry them to maintain their public image. Now they go to their normal sex life, which is having sex with men for money, kind of, pick up the virus, come back home, infect this woman, divorce, she's divorced, she marries somebody who has maybe another one or two wives, it just goes on. So we have a responsibility to break the cycle in key population. And so in the states that we work, the Institute of Human Virology makes it a point of duty to focus on key populations also.
Well, this conversation is getting very interesting. Unfortunately, we're just about out of time. But Doctor, I want to thank you very much for taking time out of your busy schedule to come here and speak to us and provide some knowledge and understanding on this subject.
Thank you very much, Stanley, and I look forward to coming back.
Thank you.
Okay.
It was such a pleasure speaking with Dr. Patrick Dakum of the Institute of Human Virology, Nigeria. From our discussion, several things have come to light. One of the prominent things that I learned is that having HIV is no longer considered a terminal condition, and HIV-positive people with treatment can go on to live long and successful lives just like anyone else. They can aspire and they can dream again. Now, we also learned that one of the key victories of this 5-decade fight to curb infectivity is that once a patient takes his or her drugs correctly, attains and maintains an undetectable viral load, the chances of that patient passing on the virus to someone else is slim to nil. This is another strong signal why stigmatization must come to an end. While we can be optimistic, we have to be careful not to be complacent. For Even though humanity has scored major victories against this silent killer, the war itself is not over. A recent NOI polls of research on sexual behavior shows that a staggering 66% of Nigerians still engage in risky sexual behavior. To counter complacency, there are several things that we need to do. Well, to begin with, messages promoting safe sex have become scarce and non-existent in some cases. The government, the National Orientation Agency, the Health Ministry, civil society, religious organizations, and other stakeholders need to synergize and ensure that the public is reminded to make responsible choices. Secondly, when you consider that the most common mode of transmission of HIV is through sexual intercourse, it's crucial to guarantee availability of prevention methods. It's become increasingly difficult over the years to find free condoms or lubricants distributed anywhere. Information also needs to be passed about the correct ways to use these preventive tools. And finally, we need to check our attitudes. Attitude can be a very powerful thing and is the greatest influencer of our behavior. Harmful religious and traditional practices need to be eliminated. A blueprint for this already exists and has been used successfully. Breaking down the barriers require a fundamental shift from acting based on stigma and superstition to acting based on science and statistical evidence. Scientists are confident that at least a functional cure can be found for this once dreaded disease. The secret to success for those living with the virus is to stay alive and healthy until either a cure is found or until you pass away at a ripe old age, hopefully, having lived a fulfilled life. Love and support from the larger society can help to make this possible. That's it on this edition of Exclusive Interview. Join us again next time. Until then, thanks for stopping by.